Hi, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. I'm recording this on Sunday afternoon, and today I watched a caravan drive through town urging an opening up of Haywood County. Now, expressing one's opinion is fundamental to our democracy. That is patriotic, but so is considering the full picture and forming that opinion. So I'd like to share some data with those of you who think the time is now, and hope you'll consider this information as you draw your opinion. Nobody knows the future, but we now have some examples for clues. Singapore was recognized as a place that did everything by the playbook early on in February and March, identifying and isolating their few cases so they didn't have to totally shut down their economy. Despite this, they saw an increase in cases by the end of March and have had to institute more drastic measures since early April. Hong Kong had around 100 cases when they reopened their economy in early March. 2 weeks later, that was 160. And by the end of March, they had to institute widespread shutdowns. As of April 19th, they have around 1,000 cases. Story's the same in Taiwan. And these are places that began addressing this pandemic way before we did. Unless you think it's only over there, what about Albany, Georgia, where gatherings at 2 funerals in late February and early March sparked an outbreak with now 500 confirmed cases and 29 deaths. Albany has 75,000 residents. It's about the size of Haywood County. And what about Joe Joyce, a beloved bar owner in Brooklyn? In early March, he thought the whole virus thing was fishy. After all, he didn't know anyone who had it, so he went on a cruise to Spain. He died from coronavirus April 9th. We've had stay-at-home orders here in Haywood County for about 3.5 weeks since March 26th, and the state instituted those the next day. Much less time than those other places who still saw outbreaks. I can safely say that if we become like Albany, our resources here will be overwhelmed. If you truly consider what we know from these events, not what we want to believe, do you still think the time is now? I think we all want to get back to some sense of normal. I know there are people in our community who are hurting, wondering how they will afford the next meal or the roof over their head, or getting really unhinged by all the isolation. And if you are in that position, please dial the call center 356-2019. There are resources out there to support you. But if you're protesting because you feel your rights are being violated, I respect that. But I also hope you will respect the reality I have shared and pause to consider which is more at risk here, your rights or your life, the lives of others around you. So be well, hang in there. We all want the same thing, but we all don't want to undo what has been achieved so far. Not yet. Give our elected officials and the healthcare community the space to make these hard choices. So stay emotionally connected and physically distant for a little longer.